As Ms. Heaton said, my name is Emily Pizel, and I want to thank you all for giving me the opportunity to present my research to you today. So I was investigating insurance coverage from the patient's point of view. So last year in Ms. Heaton's English 102 class, as a concurrent high school student, I chose a topic that wasn't your usual topic. I chose a topic that had a profound effect on my life, chronic pain. So in the beginning, when I was 12 years old, I had two passions in life. I liked to ride horses and I liked to play volleyball. Those passions were not something I could pursue due to a rare nerve disease I didn't even know I had. So there's a few key terms that we need to go over. Pudendal nerve controls bladder, bowel, and sexual function. Neuralgia is a ferocious, sharp, burning, or stabbing pain along the course of a nerve. Put it together and you get pudendal neuralgia, which is any irritation of the pudendal nerve. I emphasize the word any because pudendal neuralgia encompasses so many symptoms. So allodynia is a symptom that I had suffered from pudendal neuralgia. Allodynia is when ordinary stimuli causes severe pain. So if I take this feather and I rub it across my arm, would you say it would hurt? Probably not. Now if I take this lighter and it was lit and I rub it across my arm, would you say it would hurt? Probably. With a person suffering from allodynia and pudendal neuralgia, that is what a feather would feel like. So my timeline for my 5-year journey and battle through chronic pain is on the screen behind me. My first symptoms started in January of 2008 when I was 12 years old. 6 weeks later, I was admitted into Children's Hospital with doctors searching for a cause and for answers for my chronic pain. So after staying 10 days in Children's Hospital, I finally left with the diagnosis of neuropathic pelvic pain of unknown origin, which basically means they didn't know what the heck was wrong with me. So I want to take a minute to explain to you what my pain was like. So take a minute and imagine that tiny razor blades are cutting you from your belly button to your knees. Now this sounds bad enough, right? But now acid is poured over your body, causing excruciating burning pain, burning you from the inside out. This is what my pain was like on a daily basis. I couldn't walk, I couldn't sit, I couldn't go to school, I couldn't even walk outside because a little breeze would cause my pain to spike. So after that, my family and I traveled from California to New York City, searching for a cause and searching for answers for my pain. My search for a cause ended with my 28-day stay in Rose Medical Hospital, where I was finally diagnosed with pudendal neuralgia. Now these two words are two of my favorite words because it was finally an answer for my pain. It was finally a real diagnosis, not unknown origin. What does that even mean? So after staying in Rose Medical for a month, I then stayed in Denver for a month afterwards working with my chronic pain team. I worked with my urologist, psychologist, pelvic floor physical therapist, osteopath, qigong healer, or you name it, I had them on my team trying to stop this chronic pain. Finally, in September of 2012, my pain began to worsen again. My urologist, the head of my chronic pain team, suggested pudendal nerve decompression surgery. So when we arrived at St. Joseph's Hospital in Phoenix, which is about a 14-hour drive for my family, we get there and I was kind of nervous, anxious, I was worried about the surgery, but I was excited. I wanted this surgery. I finally had a diagnosis and about to have a cure. Well, we seemed to be sitting at the hospital forever. It was December 3rd, it was early in the morning, and we waited and waited, and name after name was called, and still we sat there. Well, finally my mom went up and talked to the assistant. They ushered us back into a private room and they told us this: your insurance has denied coverage of your surgery. No, I wanted to scream as tears rolled down my face. I need this surgery. I have to get my life back. I wasn't even living up until this point. So my family had a tough decision to make. Do we proceed with surgery, knowing we would have to self-pay for my surgery? Or do we not have the surgery and I continue to live in pain? This is a big decision for my family, but ultimately we knew the decision we were going to make. So my family had to pay $15,000 for a one-night stay in the hospital. We then had to self-pay for my surgery and are still paying on it today. Also, I had had 5 years of health problems, so dealing with that financial burden was a lot for my family to take on. Just the surgery is still costing us. So I want to take a minute to tell you what pudendal nerve decompression surgery is and what it does. So I had a Polish surgeon, and he said in his Polish accent, which I can't imitate, but he told me for like I was wondering how big my incision would be, and he told me for little butts, little incision, and for a big butt, a big incision, and he usually dealt with the bigger butts. So in pudendal nerve decompression surgery, they cut the sacrotuberous ligament, and then they cut the sacrospinous ligament as to relieve the pressure on the nerve. Next, they free up scar tissue that is entrapping the nerve. After they've shaved the scar tissue off the nerve, they take your blood platelets and bathe the nerve in your blood platelets to help it in the healing process. Finally, they repair the sacrotuberous ligament as your pelvis needs it for stability and balance. This surgery is all done microscopically, which just shows you how new and inventive this surgery really is. Then he sews you back up, and I was on my journey to wellness. So after my insurance company's denial of coverage, and having this surgery, there was a few key questions that I was asking. One that still baffles me to this day is, why didn't the insurance company cover this surgery? Then I wanted to know what criteria determines whether a surgery is insurable or not. Then I thought, should they have covered the surgery given the criteria? And then I wanted to know, what is the responsibility now of the insurance companies and the surgeons to the patient? After all, it's their life, right? So this was my working thesis. Before I even got started with my research, this is what I was trying to claim. This is what I was trying to prove. The insurance company should have covered this procedure because, as for a certain group of patients, it is a last resort. So where did I start out looking? I started out in the university library, as anyone would probably do who's searching for research, and the librarians helped me comb through the database and books there. We really couldn't find any pertinent information on pudendal neuralgia, the associated pudendal nerve decompression surgery, or even chronic pelvic pain. So then I went to primary sources. I started with my physical therapist, and she helped me comb through medical journals and anatomy books, helping me to understand the surgery I had had. Then I went to my primary care doctor, and she explained to me why Aetna had determined this surgery as experimental. And then I went to my surgeon. I mean, it was only a 10-second conversation, but it counts, right? So then I went to past patients, future and present. I went to ones that had already had the surgery, and I went to ones that were going to have the surgery. So, conducting my research, I found Aetna's bulletin. This is the bulletin in why my insurance company had denied coverage. I want to make it a point to say Aetna was not my insurance company. My insurance company took Aetna's bulletin saying this surgery was experimental and said, due to this, your surgery is no longer covered. So according to Aetna, the reasons why a surgery would be considered insurable is there would be clear documentation, meaning clear statistical data documented over time. Then there would be quantified positive outcomes. What I mean by this is, of course, there would be more patients receiving relief than pain. And then there would be numerous surgeons performing this surgery. When I did my research, there was only 5 surgeons worldwide doing this surgery. So the reasons Aetna would determine this surgery as experimental is a lack of post-op follow-up. I saw my doctor on the Monday of surgery, and then I saw him on the Friday of my post-op, and I didn't talk to him again until I called him up on the phone looking for research. So there's no guarantee of pain relief. One of the worst feelings as a patient is walking into a surgery that's supposed to help you, and it actually hurts you. The symptoms aren't black and white. So as I had said, I had allodynia, which is a common symptom of pudendal neuralgia. However, there can be symptoms from incontinence to irritable bowel syndrome to anything and everything in between. So these are a few studies I found while conducting my research. So this study was a trial that I found in the European Urology. This trial was conducted in 2004. They had 23 patients in this study. Now that doesn't seem like a big enough number for a trial, right? But that just shows you how rare this disease is. So they found that 43% of their patients had received complete relief. Then they found that 10% had received partial relief, and finally, 35% had received a worsening of symptoms. They did post-op follow-up at 6 months, a year, and a year and a half, which is the documentation that Aetna wants, saying this is how long. Nerves take the longest to heal, so you need to do documentation of this. So this was my surgeon's data that he gave me. So he said that there was a 10% chance that I could receive complete relief. Then there was an 80% chance that I could receive partial relief. And finally, a 10% chance that my symptoms could worsen. He didn't do post-op follow-up, and that's not reliable statistical data. However, he's been inventing new technology. He has made the sheath better, or that they wrap the nerve in, so that it's more pliable and doesn't break. Also, his physician's assistant, when we asked him, she said that his data is actually probably better than this, but he just doesn't keep the documentation to back it. So this was my working thesis, and I actually found that I couldn't claim this or prove this. So then I came up with a new thesis, and I said, while this procedure is not covered due to the necessary criteria, it is considered revolutionary by the experts in the field, both for patients who have suffered from years of misdiagnosis, chronic pain, and the associated psychological effects. So what should happen now? After conducting my research and contemplating on this for about a year, I found that what I was asking was a call to action. What needs to happen now for the benefit of the patients is surgeons should be held accountable for statistical documentation, meaning they need to document this patient received 80% relief. This person received this much relief. So that when someone like Aetna comes up and says this surgery is experimental, you can say, no, it's not. We have the documentation saying this surgery works. So then the insurance company and the patient's call to action is closely related, meaning the insurance company should take a comprehensive look at their process for determining insurability. What I mean by this is they need to take a more personal review of the patient's history, meaning therapies tried, consultation with primary care doctor, even a consultation with the patient. So the insurance company wants reliable statistical data, which makes sense, right? Well, it just isn't there. As I said, there was only 23 patients in that trial. That number is about how many there would be of this surgery per year. There's just not the statistical documentation that they want. Also, the insurance company takes a physician who is just an MD, and they look at the surgery, case by case, right? This surgery, why is she having this surgery? But they don't look at past things. So they don't talk to the experts in the field, and they don't go back and say, this person dealt with 5 years of chronic pain. They went to Stanford Medical Center. They had a consultation with Mayo Clinic. Those are big deals, right? But they don't look at any of this, just the surgery. And they need to take a more comprehensive look and have a collaboration with the surgeons, the patient, and the insurance company to make an educated decision. So in summary, I found while doing my research, this is what I think now. I agree with Aetna. This surgery is experimental. However, because it is an experimental surgery for a certain group of patients who have no more options, that is why it is insurable. So the future of patients is depending on this insurability of this surgery, right? So I walked into my post-op follow-up, and a man walked up to the counter. And he was scheduled for surgery on a Monday, and they told him, I'm sorry, your surgery has been denied. Now, unlike me and having my parents' backing and their financial support to go through this surgery, he wasn't able to do that. And he had to walk out step by step, walking out, suffering for years and years of pain. Can you imagine? You're supposed to have this surgery and they tell you, no, you can't. I'm sorry, you just have to suffer through because this is considered experimental and uninsurable. That's not right. It's the patient's life, not the insurance companies. And it needs to be a collaborative decision between the insurance company, the surgeons, and the patients. This was my works cited, and I want to take a minute to acknowledge the people who gave me their time and attention as I did my research. Dr. Nell Gehrig, my primary care doctor, Dr. Michael Hibner, my surgeon, and then my physical therapists, Sarah Huddleston and Terry Nishimoto. I also want to thank Ms. Heaton, who mentored me and helped me with my research, and both of my parents who were very supportive through my research and through my entire chronic pain. Thank you. Are there any questions? Any questions? Sure.
So, imagine tomorrow you're in charge of making policy on this. You mentioned sort of a black and white distinction between experimental and non-experimental categories. Would you create a third, maybe? Would you, if you were in charge of this, how might you change policy?
So the insurance company really needs to take a look from the experts thing, and that's what I think is missing. The experts and also taking a consultation with the patient is what they don't have in their policy. So what they're saying is they take an MD and they just look at the surgery, but they don't look at anything like having to do with the patient or any experts in the field, like doing research on that. And that's what I think needs to change in the policies that they have. Also, like while I say that this is experimental, what I was first proving was this was a revolutionary surgery for a certain group of patients. So what I mean by this is it's looking at past history. So they have to look at therapies tried. Hey, if you've gone through 5 years and you've gone to Mayo Clinic and Stanford Medical Center and they can't find out what is wrong and this is finally like a cure for that, I think the insurance company just needs to take a broader look and look at past things tried in their policy.
Have you considered appealing the decision, especially given this really compelling research?
We did appeal this decision, and my parents both wrote a letter, and so did my primary care doctor, and also my surgeon wrote a letter to appeal the decision of the insurance company, and they won't budge on like the denial of claim. So we all tried to get it redone, and they are just like, nope, it's experimental, and now it can't be covered because it's too late. So. Any further questions? Any further questions?
So how did the surgery work for you?
Okay, so according to his data, I'd be in like the partial relief because I still have pain. But according to me, I have like 110% relief because I couldn't walk, I couldn't sit. I pretty much laid on the couch and did nothing. I couldn't have any clothing touching me, so any like sheets or garments would cause severe pain. I couldn't be on a bed, so I'd bow back, like lift up, so that nothing was touching my skin. And my doctor said, so like on the pain scale of 1 to 10, that I was about a 50 when I was in pain and I looked like I was possessed. So from there to here and being in college and presenting to you, I'm 110% better because of this surgery. Any further questions? Sure.
What are some limitations that you might have going forward?
So I can't bend past 90 degrees, so I can't squat at all. Oh, that's a big no-no. I have to carry a pad around with me, so everyone at college looks at me funny because I carry like this little padded thing around. But I have to have that because or else it puts too much pressure on the nerve and it causes me pain. And then like if I go a day and I go to class and then I'm working on stuff, I have to, like when I'm doing my homework, I have to lay down while I'm doing it because just the sitting for so long is too much. And also I said that I like to ride horses, and actually this last weekend I was allowed to get on for 5 minutes and just walk around. But I used to ride horses, I used to play volleyball, and I really am not allowed to do any of that now. So I found new passions in life, but still kind of sad. Any further questions?
Do they know like what causes this? Is this just like kind of like bad luck, or is it like, do you have any ideas? Or
It can be kind of like you're just, sometimes people are just predisposed, I'm sorry, excuse me. Okay, to get this, but other times it can be so like if you do a lot of like squatting and like pressure here, so they think because I rode horses like constantly and I did that a lot, that could be, and I'm so thin that could have caused it. Also, it can be like a fall, so like if you fall off something and you entrap it that way, it just never heals. So. Any further questions? Thank you, guys.